I'm Bruce Spurlock with Sign Your Health. I'm here to talk about our partnership with CQC, the California Quality Collaborative, the Gordon and Betty Moore Foundation, and hospitals and their partners throughout Northern California on the Avoiding Readmissions Through Collaboration project, or what we call the ARC project. ARC is a fun community of people that get together to talk about reducing avoidable readmissions to the benefit of the patients who don't need to go to the hospital again when they can receive care and stay healthy in their homes and wherever they're living. What we've been able to do is to put hospitals, medical groups, and other ambulatory partners together to think about ways of talking about and communicating with the discharge process and the transition from the hospital setting to the other ambulatory and other settings where patients get their care. So we're trying to break down barriers, we're trying to establish new communication tools, new ways of streamlining the transition process in healthcare. And you're about to hear from some of the participants and the success that they've had.
Participation in ARC was a godsend to our organization. The transition care program was suggested 2 years before ARC became available, and it was diffuse. There was a lot of interest, there were a lot of people doing things, but individually. And the participation in a collaborative allowed us to bring back an external authority or an external reviewer that focused everybody's attention on specific goals. So I guess I would say that allowing us to be specific about what we wanted to accomplish was the best thing.
We have a lot of wonderful, great thinkers in our organization, but everybody was sort of doing their own thing. And I think that this collaborative and the approach here of doing an analysis and bringing together a multidisciplinary team really helped us to figure out some focus for our efforts. The other thing that I think was great was stressing as a collaborative, bringing in people that you wouldn't normally bring into your work, meaning reaching out to your community as well as just to other hospitals, and including patients and their families. So that was something that we came to and are now going to include in other aspects of work that we do, is bringing in that patient voice. I think on another level, you can read all you want on the internet or in journals about evidence-based models and say, wow, those really sound great. But what the collaborative brings to it is a demonstration of how this can be implemented in real facilities, community hospitals, some academic centers, and it shows how you can tweak it and you can still be consistent with the model and do all of the right things, but you can make it real in your setting. And I think that gives folks like us courage to take on this work and to bring these models into our own organization.
We personally, Alameda County, went and did some site visits at UCSF and at the General and learned a lot from them as to what they're doing. So they have a heart failure clinic that's inpatient, and then the General is using Project Red. And so it's been nice to see how they've actually accomplished implementing this in their programs, and we're using some of what they're doing and applying that to what we're doing at Highland. So it's been great.
Where else could you get this experience? It's like having your own university built in. You get education every time you come. I learn something every time.